Here's the tagline: Xanax is for quick relief, Ativan for steadier comfort. Brenda recently did a great video on lorazepam and how it's used in hospice care. This stimulated several questions from our subscribers regarding the medications alprazolam or Xanax versus Ativan or lorazepam. We had several questions asked about the differences between Xanax, which is the brand name for alprazolam, and Ativan, which is the brand name for lorazepam. Both Xanax and Ativan belong to the same drug family, a benzodiazepine, but they act differently and how long they last and what they're best used for. So let's review the facts about the differences. First, Xanax, or alprazolam, is used as a fast onset drug. It works quickly, within 15 to 30 minutes. Its duration, however, is short acting, and that means it only lasts for about 4 to 6 hours. Xanax, or alprazolam, is best for those sudden or very severe a panic attack, anxiety attack. Also, a very important consideration is that the relief is short-lived, only about 4 hours, so the symptoms can come back more quickly. And because of the fast onset, it may feel stronger, but also it increases the risk of needing more doses. And there is a higher risk of dependence or addiction because of that rush-type feeling. Now let's talk about lorazepam, or the brand name Ativan. This is the medication Brenda very clearly described last week. Lorazepam also has a fairly quick onset, not as long as Xanax, but it's usually felt at about 20 to 30 minutes. And the key difference between it and Xanax is its duration is not short, but intermediate acting. That means it lasts for about 6 to 8 hours. So it's best used for general anxiety and worry, agitation, insomnia, seizures, even shortness of breath. Sometimes it's used even to help calm someone before a procedure they may be facing, like an MRI or surgery that would, be frightening to them. Just in that description, you can see that lorazepam has more uses in diverse symptom management. So let's consider that the longer acting makes it steadier than Xanax. It gives less of a rush feeling than Xanax. Another reason it is less habit or addictive forming than Xanax. One last plug for lorazepam is that it is cleared differently by the body and can be safer for patients with liver problems, the older patient, or those with organ decline. So again, those key differences: Xanax hits faster and stronger, which can feel more effective if chosen for the patient who has sudden panic attacks. But remember, it's also more habit forming. Lorazepam lasts a little longer, and it's sometimes preferred in hospice for that ongoing anxiety, agitation, shortness of breath, or insomnia. It gives a more sustained, calm relief. Also, I might mention that lorazepam also has an anti-nausea feature, which allows it to be used for multiple symptoms when it's needed very quickly, before another medication can be prescribed and delivered. Both are used with palliative and hospice care, and we always start at the lowest and safely effective dose, always with the goal to provide calmness, comfort, and dignity. Both can be very effective, but should always be used under close medical guidance, especially in hospice and palliative care, where the goal is comfort, calm, and safety. I certainly hope that helps to answer the questions, and I know that Brenda and I always have the mission to transform the end-of-life experience with education and support. Join us by subscribing to us at our website, the Hospice Care Plan, or on YouTube, or your favorite social media site. Don't forget to pick up our booklet, The Hospice Care Plan, A Path to Comfort. So all of our tips and care and symptom management are right there at your fingertips. Whether you choose a digital or a print version, they're very inexpensive, $17. And we want to support you, whether you're a patient, family member, or a hospice team member. Always remember our motto: care is treatment.